Hi guys, welcome back to my channel Made Simply Easy. In this video we are going to see about ADHD, Attention Deficit Hyperactivity Disorder. It is the most common neurobehavioral disorder of childhood. It affects 3 to 5% of school age children. The prevalence in India is 1.3 in 1000 children. It is 3 times more common in boys. It is defined as a neurodevelopmental disorder characterized by persistent inattention, hyperactivity, and impulsivity causing significant impairment of learning and social functioning. Comorbidities. ADHD is associated with learning disability, tics, sleep problems, enuresis, encopresis, obesity, anxiety, depression, bipolar disorder, oppositional defiant disorder, conduct disorder, and autism spectrum disorder. Risk factors for ADHD are maternal smoking and alcohol consumption, abnormality in dopamine transporter gene and thyroid receptor beta gene, mutations of DAT1 and DRD4 genes, lead and mercury exposure, traumatic brain injury, and epilepsy. Pathology. Children with ADHD have 5 to 10% reduction in brain volume. Atypical functioning in the frontal lobes, basal ganglia, corpus callosum, and cerebellar vermis is seen. Functional MRI shows reduced blood flow to the striatum, and it may be also related to the disturbance in the dopamine or norepinephrine system. Genetics also play a major role, which is shown by the twin and family studies. Clinical features of ADHD are inattention, so the child is easily distracted and has difficulty sustaining attention. Impulsivity, so which means intrusive, interruptive, and can't wait for turn. Motor restlessness is also seen. Hyperactivity, so the child is often on the go and fidgety. Emotional liability is also seen, and there is also history of disruptive behavior in school. Now the following points are the DSM-5 criteria for ADHD. There is persistent inattention and or hyperactivity. So that means there can be either persistent inattention or hyperactivity, or both can also be present. So if hyperactivity is present, that means it is impulsivity that interferes with functioning or development. And the symptoms should persist for at least 6 months, and the symptoms should be present in 2 or more settings, for example in both home and school. And these symptoms must begin before 12 years of age, and all these symptoms must interfere with the social, academic, or occupational functioning. Most importantly, these symptoms must not be secondary to another disorder. Investigations: MRI, metabolic tests such as serum ammonia bicarbonate, lactate, sugar, and blood TMS, which is tandem mass spectrophotometry, and urine GCMS, which is gas chromatography mass spectrophotometry. Gas chromatography mass spectrophotometry. Genetic studies such as cytogenetic studies and karyotyping can also be done. TFT, blood and urine lead levels are also required, and electrophysiology tests are also done. Management. Behavioral therapy and medical management are usually the 2 points required for management. So in medical management, it is usually not recommended in children below 6 years. Methylphenidate is a presynaptic dopaminergic agonist. It is a stimulant. So and the side effects of methylphenidate is anorexia, headache, abdominal pain, irritability, and growth disturbances. Atomozitine is also given for ADHD. It is a noradrenergic reuptake inhibitor. It is a non-stimulant. So, and the side effects are dyspepsia, nausea, reduced appetite, and weight loss. Other drugs that are used for ADHD are antidepressants such as imipramine and bupropion, amphetamine derivatives, and magnesium primoline, and alpha adrenergic agonists such as clonidine. Thanks for watching. Subscribe for more such videos and check the Pediatrics playlist for other videos. And also let me know your suggestions below in the comment box.